Welcome back, everyone. Urinary tract infections, or UTIs, they're pretty common. It's estimated that just over 10% of women have this type of infection each year. It's also estimated that over half of women will have at least one UTI in her lifetime.
To help us better understand what a UTI is and how it may be treated or prevented, you need to know what makes up your urinary tract. To shed some light on this and keep us on track is Daytime's Herbal Pharmacist, Dave Foreman. Welcome, Dave.
Oh, that was good.
Thank you.
That was good.
Good to have you here. We mentioned women in the lead, but men get UTIs as well, right?
It's actually probably as prevalent in men when we're not men. Little kids, little boys. But after a certain age,
Not so much.
you ladies kind of put us...
Okay, we take over in the UTI department.
Exactly.
Lucky us. So what causes this infection?
Well, it's when bacteria actually makes its way into your urinary tract, usually from the urethra. So where urine comes out is usually where the bacteria will start to go in. And that's the main process. And then the urinary tract is actually made up of not just the bladder, which most people think of bladder infections, and in medicine they call it a UTI, but if that bacteria ends up making its way up into your kidneys, then you've got the kidney infection, which is a much more severe situation going on. Then you're kind of between the rock and a hard place on that.
Well, Dave, the burning question here is, what do we do about this?
This is good.
Let's talk about the symptoms first. So that
Actually, burning, more frequent urination. You just feel like you have that pressure building up in your bladder. Some women, or actually men both, you'll even develop maybe some leaking. You'll be unable to turn off the stream. The burning is usually in the bladder. You might even feel bladder spasms, and sometimes that'll actually lead to where you're feeling even digestively messed up. And then more severe cases are you'll actually develop a fever. And if you get to that point, you really need to seek medical advice ASAP.
Now, I've heard that drinking cranberry juice can really help, but if you're at that point and you're burning and everything's feeling bad, that's not going to cut it, is it?
Well, I'm not a big cranberry juice fan anyway. Most people will go to the grocery store and buy like cranberry cocktail or whatever, and the majority of what's in that is not even cranberry. It's water and sugar and a whole bunch of other things that you probably don't want. So yeah, when you get to the more severe cases, you really need to seek medical advice. Regretfully, a lot of the women that develop a UTI will continue to develop them maybe once a year or several times a year. And in modern medicine, they often treat it with antibiotics, and we now have science showing that you don't have to do that, which is really cool.
Is there something we can take regularly to prevent them from happening in the first place?
Yeah, there's two basic things I recommend, and one is to use a cranberry extract, and the one that I just recently found that has all the science is called Cranmax. I brought an example of it today. Cranmax is actually the name of the ingredient. It's a specific type of cranberry extract, and they've compared it head-to-head with prescription antibiotic and found that it was as effective at preventing recurrent urinary tract infections, but the cool thing is you don't get all the side effects that go along with taking an antibiotic. And then the second thing I always recommend is to take a probiotic, a friendly bacteria. Now I know, Cindy, you and I have talked about those before in the past.
I take it every day.
Yeah, probiotic is friendly bacteria, and if you have enough of these friendly bacteria, it will suppress the bad bacteria that literally cause the urinary tract infection. So if you have enough of these good bacteria in your digestive system, you're less likely to have those bacteria even make its way to where it may end up getting into your urinary tract.
And you might want to avoid sugars and white foods, right? Is that correct?
Sugars lower your immune function. That's one of the evil culprits for sure. Starchy foods that convert to sugar, I call them the white foods. Drinking a lot more water. I mean, it sounds kind of like a no-brainer, but drinking a lot more water, not coffee and tea and things like that. Making sure.
Allergies have something to do with this?
Definitely. Food allergies, food sensitivities, not urinating frequently. A lot of people, because of work, they hold it.
Hold it.
Yeah,
we do. We're guilty of that.
Proper hygiene, which no one ever wants to talk about,
But
know which way to go.
Right.
A lot of women, after maybe sexual contact, they need to make sure they urinate after that because bacteria can make their way in that way also.
All right. Okay. So Flora Smart and Cranmax.
Exactly.
All right. Thank you, Dave Foreman.
Thanks a lot for having me. I appreciate it.